morning, and it's late at night in Europe. Yeah, thank you.
Yes, it's the night in Europe and it's the morning for you. Okay, so the reason I reached out to you, it was to understand the intersection between human behavior and the built environment working as a stimulus for our brain. I know, and I want to introduce you. You are an architect.
Yes.
Currently, you work in design psychology because you have a PhD in psychology of design.
Yes, correct. Yeah.
Correct. And you work constantly with the salutogenic design model for the healthcare facilities.
Yeah, not constantly. It's one of the things I do. Yes. Care facilities. I also do schools. It really, I don't care where the knowledge is applied, frankly. It's got to be used everywhere as far as I'm concerned. But I used salutogenic design, and I also use ecological principles of design as well, which is something a little bit different, but quite closely related.
Ecological. Okay.
Yeah.
Can I ask you a bit about you? Where did you born and where did you grow up?
Okay. I was born in Australia, in rural Australia. First part of my life, I grew up in England. I moved there when I was just a baby. And then when I was about 5 years old, I moved to Melbourne, Australia. And then from there to Canberra, Australia, which is the capital city of Australia. And I grew up there until I was almost a teenager. I was 11 years old. And after that, my family, my father had died and my mother remarried an anthropologist. And we went to live in the jungles of Papua New Guinea, Papua Nouvelle Guinea, I think it is in French. And we lived there for a while, coming back to Australia, to Cairns at first, then to Canberra. And then when I was a teenager still, an adult teenager, I went traveling around the world for a couple of years. I had quite a few adventures. And then after that, I moved to Sydney. From Sydney, I got married very soon after returning from overseas. And my wife and I have lived in India, UK, and also in America.
Wow, South America.
No, North America at
North
Berkeley.
America.
Yeah, we've traveled widely, but lived in those places.
Wow, wow, this is quite a long story for a young person like you. Tell me, do you think your childhood environment and all these experiences that you had led you to research into this topic, or has no connection at all?
Look, I wouldn't say it has no connection at all, but no, it's not what led me to research this topic. I was interested in architecture from a very young age. A close family friend was the Australian government architect who was responsible for commissioning the new Parliament House. His name was Peter Muller, and he was a close family friend, and I found his work fascinating, and his life I found fascinating as a child. And so I used to go and visit him regularly with little drawings, and he'd sit down there with me with my drawings and take them really, really seriously and teach me about architecture and say, well, you know, when you look at a building in this position, you have to look at how the sun moves. Look at how the building's oriented toward the sun, to the wind. And what you can do here is, instead of having a skylight, or you can do this and that. And he took me seriously like no other adults did. And I used to go there regularly. He was very, very senior, very experienced architect, one of Australia's great architects. And he infected me with a love for architecture, which never went away. And I had all these extraordinary experiences and came back to architecture. I became an architect. And as part of that process, I started a PhD. During the PhD, I stumbled upon a German psychologist, from the American University in Beirut, American University in
American
Lebanon.
University of Beirut.
Yeah, Beirut. His name is Arne Dietrich, and he's a very accomplished neuroscientist. And I asked him if he could supervise my thesis. I was frustrated with my own supervisor at the time, and he said absolutely he would, but the first thing I'd have to do is forget about architecture. I knew enough about architecture. That wasn't what he wanted me to look at. He wanted me to look at neuroscience and understand what it was that I was trying to discover. And I was fascinated at the time by how buildings can affect mental health. The reason for that was in a previous job as an architect, I'd been designing mental health facilities, and my boss had said, oh, no, we don't try and make the facility in such a way that it helps people with mental illness. We do as we're told as far as the design of the facility is concerned, and we just build institutions.
Right.
And so I was kind of unsatisfied with that attitude from my boss, but it wasn't just from my boss, it was from the whole industry, and decided that I needed to do more research. And I couldn't do research on their company time. You know, there's no budget for research. So I went back to university and studied and did my PhD on design and mental illness, schizophrenia particularly. That's when I met Arne Dietrich, and he said, oh, well, time to forget about design, let's start looking at mental illness. And it was a real step in the dark for me. And I discovered some very cogent relationships between architecture and mental illness, which were explored in PhD and in some 100 presentations and articles since.
Thank you. Okay, Professor, if I want to provide something now to the audience, like if you can explain us what is an evidence-based design, what because coming from your answer right now about the science, the importance of science. So what is an evidence-based design in what you are doing?
Well, you have to be careful with the term evidence-based design, or EBD, because evidence-based design is more like a trademark for an American organization which has a standard for using in design. And the standard is a rather high standard. I mean, it's a great standard. I don't object to it, but it doesn't acknowledge where design is at. Design is in some ways a new science. It's only was first taught in the universities maybe in the 1970s and 80s. You know, it's a very recent thing to turn to science. Before then, it was considered to be a craft. And we don't have a great deal of evidence around design theory. We can gather evidence about how a design works, but the design evidence is always specific to the building in question. For example, if I were to design a building and use evidence-based design principles, I would have to go to a previous building that's already been designed and filled with people of the same type that I'm looking at bringing into my building. And I would have to make some big changes to that building in order to prove that this building does this particular effect to that cohort of people. And you go, well, very well and good, but if you have any idea of how expensive it is to build a building and how much effort there is in building a building, you can understand that those kinds of experimentations are impossible and they never happen. So instead, There are what's called naturalistic designs, where there happen to be two wings of a hospital that are more or less identical, but one happens to look north maybe, and the other one looks south. So one has an aspect with sunlight and another one has an aspect without. Or one looks into a forest and the other one looks into a car park or something like that. And then if they put identical cohorts or very similar cohorts of people inside, then they can start studying the differences of behavior, recovery, and so forth of the people inside those spaces. That's called the naturalistic design. And you can bring out data, and there's some fantastic data from naturalistic designs. And that is evidence with which you can design future things. But you still need to say, well, this building in this context is similar enough to what I'm building in this completely different context that I can use this evidence. And actually that's scientifically invalid. Well, not invalid, but it's scientifically questionable. So evidence-based design, as the term appears to come across, isn't really the best tool that we have. Right now in design, the best way we can go forward is using a mixture of evidence-based design, where we have it or where we can get it easily, and research-based design, which means that we are looking at theoretical models as a way of approaching the design problem. So not interested in what happens so specifically in a singular spot, which might not be replicated outside. We have to look at what happens within a whole context. How do people behave? What happens if you do this to a person? What happens if you do that to a person? And then we take that information and we apply it to the whole environment. That way we get a much more holistic idea of what the environment is doing for a person. And that's often called research-based design. And so most of my work is based on theoretical models rather than on direct evidence.
Great. That's amazing to know that there is research methods, but even though with the quantitative and the qualitative is not enough, you need to, because the internal environment of each person and the external environment, to make it match on each person, it will be difficult. You have to have this research. Yeah, it's like
you need to know how people tick, and once you have a good model, a good handle on how people tick, on what the conditions are that you're trying to address. Like, for example, creativity. How do you design for creativity? You can go, oh, my evidence-based design says you design theatre, concert theatres, because all these creative people play their instruments in concert theatres. And yeah, sure, that's true. But what if you're not talking about the theatre, the creativity of a musician? You're talking about the creativity of a patent attorney. Yeah, it's a different setup. And there are ways that we can design for creativity generally. But you can't just take what has been done in the past. You have to look at what we're trying to achieve. And that's something different. So to design for creativity, to use the same example, you can design much more dynamic spaces where people can actually change the space from within, with maybe removable, movable furniture, changeable partitions, changeable light, changeable ventilation systems, changeable acoustics, so that you can feel that you're interacting with the environment very meaningfully. And if you can feel that you're customizing the environment very meaningfully to make the kind of right environment for you just now, or for your team just now, you're likely to find very strong creative outputs from that.
Thank you. So it's maybe, if I understand you right, is the dynamic and the synergy of the elements in the design that might reach that
Correct.
point. Yeah. Okay.
Correct. Yes.
So in your research, you investigate and you apply the salutogenic design model.
Yes, the salutogenic. So salutogenesis, the theory of salutogenesis, which was invented by a man called Aaron Antonovsky and developed by a man called Aaron Antonovsky, was really a theory of sociology. So a sociological theory. A professor by the name of Alan Delany, pardon me, brought that into design, into architectural design in the early 2000s. He published a couple of papers in 2005 and 2006. And I really picked up where he was coming from and developed that further to bring it into design. So the idea of salutogenic design comes from our branch of the salutogenic tree. Now, salutogenic is a technical term, and it refers to this theory that we intrinsically, where should I start? We intrinsically are healthy beings, and we aim to be healthier and stronger, but we are always being pushed back by difficulties in our environment and by various stresses, tensions, difficulties, and setbacks. And what really propels us forward are three elements: meaningfulness, comprehensibility, and manageability. Manageability is the ability that we have to engage with and manage our environment. It usually involves physical actions. So, if we're, for a normal person in their normal day-to-day existence, manageability is the ability to get up, get themselves dressed in the morning, get out to work and do what they have to do. Comprehensibility is about the intellectual engagement with the world around us. It's about knowing what to do. It's about knowing where to go and how to do things. So we, in our normal day-to-day existence, it's not just about being able to do the things. You know, it's not like being able to hammer the hammer, but it's about understanding how things go together, knowing, for example, what size nail to use if you're using a hammer, and knowing what you're compiling and how to put it together. And you go, oh, hang on, for that kind of joint, you don't use a hammer, you should be using a screw, right? So that is a more intellectual domain, and that is about comprehensibility. Meaningfulness, which is another topic again, is about why. It's about what's in it for me, in my heart. And so going back to the nail and the hammer, it's about why I'm building this in the first place. Am I building this house as a house that I can live in? Am I building this house for the people that I love? Or am I building this house just because it's work, right? So where is the meaning in it for me? Because if I'm building it just because I want to be paid and I don't care if I'm using the wrong screw. I don't care if the nail's too short. Provided it gets signed off at the end of the day by my supervisor, that's fine. So meaningfulness is, in a sense, the key to understanding our drive to succeed and to achieve and to do great things in life. And so when this is applied to architecture, to make a building that's manageable is quite a basic and quite a small challenge. Well, you know, it's something that's achieved a lot. We have to make a building that's usable. We have to make a building that's accessible. That often means universally accessible for people with wheelchairs and people who are blind, etc. It means making a building that is functional. If you live in a cold country such as northern Canada, you don't want a place that has paper-thin walls. You need a place that will keep you warm in winter and cool when the sun's out in summer, and even dark so that you can sleep in summer. So you have different kinds of manageability needs. For comprehensibility in building is about understanding, it's about enabling the person in the building to get what they want, to understand the building and to get what they want. This is particularly important in institutional architecture. If you've ever been to one of those hospitals that has miles and miles of corridors, you know, how do you find your way? How do you know where to go without having to ask specific advice? This is part of the comprehensibility problem. Wayfinding is part of the comprehensibility problem. But if you can use a building in such a way that comprehensibility doesn't just help you get the ordinary things out of life, but comprehensibility helps you get the extraordinary things out of life. So comprehensibility in a building might be, it might be about understanding such things as, sorry, I'm
maybe
stopping.
the coherence between
Yeah,
the end user.
So all of these things come together as coherence. But comprehensibility in a building might be about simply reminding us about what we're there for. For example, a really good example is the WWF, World Wildlife Fund building in UK, where the building has this kind of ecological design. It is a LEED 7-star building, which means that the sun hitting the roof is turned to electricity, and there are trees inside the building, and it's this really environmental building. And that reminds us constantly about what our motivations are, and who we are in the building, and what we're to do in the building. So it's somehow giving us back something that is of an intellectual level. Meaningfulness in a building is even more important and the hardest to achieve, because meaningfulness is intrinsically personal. But meaningfulness in a building is about, it can be about human connections. So meaningfulness occurs wherever we stop caring about just ourselves and start caring about others and the things that we love and the people that we care for and the world around us, and even religious values and whatever it is. Okay? Doesn't matter what it is. It can be completely abstract. It doesn't need to even be true. But the moment we're caring about something beyond ourselves, that is where we find our meaningfulness, in that intensity of caring. And we can provide for that specifically for individuals by designing, maybe a chapel for their particular religious values, or we might be looking more generically at the human needs that unite us all, the need for companionship, designing really good places where people can connect with each other, designing places where people can connect with animals, for example. All of these sorts of things provide meaningfulness.
Wow, this is extensive and dense, and how, for example, an architect, designer can apply this without missing some of this, it's quite...
It's difficult. It's difficult. It's difficult even for me, and I've been doing it for years. So it's worth reading up more about it, because when I write something, I spend months, laboring every word, so I know what I'm saying.
Yeah, I can tell you that when my cousin Marcel Barakat, that he talked to me about you, he told me about you, and I started researching about the salutogenic design model. I said, okay, I'm going to absorb this. No, I couldn't absorb it. I've been reading for the past 4 months, and I still cannot absorb it, but I find it perhaps the most important and fascinating topic to apply in our daily life, because how we can architect our life and the life of others if we don't have these important tools to provide something different than just this it's like selfish. Design by itself is selfish. So to provide something that will help the end user thrive in times of uncertainty, difficulty, sickness,
It's interesting that you talk about it, you know, just at the end of a period of intense selfishness in design, where we had deconstructionist design, where buildings really didn't serve any function other than to gratify the architect. So you're absolutely right. But to say that we need salutogenic tools is also not true. We've been doing this as a society for thousands of years. It's just that now we're starting to develop a language where we can do it more scientifically, more deliberately. They're fantastic buildings that are salutogenic buildings where the designers and the users have never heard of salutogenesis.
Yeah.
Because it's a new theory, yeah.
And salutogenesis means the study of the health, but not of
Yes,
the pathology. And the pathology is the sickness, right?
correct. So salus means health. Genesis means creating health. And so the pathogenic model of medicine is where we say that health exists, but health is threatened by specific illnesses. And so we address the illness itself in order to get rid of the problem, and therefore health exists. And yeah, to some extent, it's a fantastic model. It's hugely successful. It's the reason why we live for so many more years now than we did 100 years ago.
And
but it doesn't look at the whole. You know, we can actually create health without having to have a health issue, without having to be ill.
Mm-hmm. To improve our well-being and mental health. And schizophrenia, this is one of your research and your work. How can you treat patients, being an architect? How can you help them thrive with their built environment in a hospital that is so difficult to, you know, like you say, and your approach is against a building for the nurses or for the doctors, but not for the patients. Like you make so much sense with this, you know. How?
Well, you know, I'm lucky. It's the easiest paradigm to do better in, because what is currently being done and what has been done for years is atrocious.
There is no transition.
Because there's so little understanding of mental illness, even inside the medical field. We're good at diagnosing it. We're just not good at understanding what it is as doctors and nurses. The treatment is all about them. It's all about the doctors and nurses. It's all about, well, if we when we get these patients in, they can be brought here and they can be processed here, and then they can be moved to that room, and then we can do this and this and this with them, and they're treated like cattle. And the environment that they're put in is atrocious. If you've ever been to a mental health facility, and I've seen a few, they're really horrendous places. I've never seen one that I think, wow, this is a nice place to be in. And so the first step is to make a place where you go, wow, this is a nice place to be in. And in the designs that I've done for mental health facilities, that is exactly the brief. And we stopped calling them mental health facilities at this stage. We call them recovery centers or rejuvenation centers or something like that. And we design them as such. We design them so that they're much more like a spa. They're much more like an extraordinary place to be, so that people who go there kind of feel happy to be there. Because if you can capture that happiness in the first 2 or 3 minutes of exposure to a new environment, it's really hard to shake off. In the same way that if you tell people, if you show people that the place is a horrendous place in the first 2 or 3 minutes, they're not going to shake off that idea either, even if it turns out to be a really nice place. So we design in such a way, very schematically, so that the journey of a patient into the facility is an extraordinary transition from the point where we have no control, that is the arrival in a police van probably, to the actual coming in the door. The moment people enter the building, we create a sense of paradise. We deliberately design all sorts of what's called affordance. This is the ecological theory of perception. We design a whole lot of affordance so that people go in that space and go, wow, this place is nice. This place makes me feel good. This place, I feel like I can do with a rest here. This will be perfect for me. You know, and if you can really capture that in your building paradigm, you're going to do something extraordinary for those people suffering mental illness. Mental illness is a tough thing to suffer from, you know. Don't make it worse with a bad environment.
Yeah. And it's the internal environment that they already, for patients with schizophrenia, they already have an internal environment that will get triggered by an environment that looks so cold, so...
Last thing we want to do is trigger people. We have to be very, very careful, and we have to have a very strong understanding of what things are triggering. And so the ecological theory of perception, the ETP, James Jerome Gibson's theory, is very useful for understanding that. People don't respond only to their own internal processes. People are highly responsive to the environments that they find themselves in. And it's about understanding what they're reacting to and why, and managing that process from the outset.
That makes a lot of sense. And that's why doctors in Spain had taken their patients out to the beach with COVID-19. They took them out to the beach in their beds to increase their, to boost their immune system, to increase their well-being, because of the biophilia. You know, our love for nature is stronger than anything else. So if there is biophilia, something will get better, no matter what. It's in our nature, it's genetical, it's biologically.
So the way that I reframe the biophilia hypothesis, which is Wilson's 1980 work, the way that I reframe the biophilia hypothesis is that it relates directly to meaningfulness. So it's one of the ways that we develop meaning in architecture is through the biological environment, the greenery, and so-called nature or naturalistic.
Wow. And right now, for example, now we are confined. For example, I'm in France, we are in confinement. The salutogenic design model should, on the ecologic design model, your model in general, what you are doing, it will be easy to apply in our residences, because our residences have become our work right now. We work from home, we take care of our kids, we shower, we cook, we do everything at home, but the environment is not helping us, not even 1% to feel better. I have to always go to the balcony, look, to feel better. So how can we do it at home?
Okay, so I've been through a lockdown. All of us in Australia have been through a lockdown. But fortunately, where I live in Australia, there's no more COVID. There hasn't been for some time now. There's a new outbreak in a city far away from us. 20 people have it, so it's not like France. It's not like most of the world. It's still almost nothing in Australia. So, you know, we're very fortunate right now.
Very good.
But without gloating, there are some things that we can actually do to help with COVID using design. I'm editing a journal at the moment, the Architectural Science Review. It's a really good journal. And one of the authors, and I can't say too much about it yet because it hasn't been published yet, it has just passed review. One of the authors did some studies before COVID on resistance to the flu, to resistance to viral infection in aged care facilities. And the authors discovered that environments that have unfettered access to the natural environment, to really quality gardens especially, but really lovely gardens, find themselves, I'm trying to recall the exact numbers, between 80 and 90% protected against the flu compared to the people that sit indoors because they don't have good access to the environment. So we're talking about huge numbers here. We're finding a massive protection factor of just being allowed outdoors. And I think that that's a really important one for viral infection. And it does speak to the biophilia hypothesis very strongly, but it also speaks to the salutogenic one. If we are living in an aged care facility and we have good access to gardens, it is singularly the most important way that we can build meaningfulness. And if there's meaningfulness, then there's desire to go forward, there's desire to live, and if there's desire to live, it means that we're much more likely to survive. Wow. So our own private homes, of course, we can do things as well. First of all, wherever possible, it's a really good idea not to be doing your work from your bedroom, if you can avoid it. If you can avoid it, because then your bedroom becomes your workplace, and it starts interrupting your sleep cycle.
Yeah.
Where it can't be avoided, you can't avoid it. Another thing is to make sure that you're participating in social events, even if they're through Zoom and various social distancing methods, because it's still very important that we have that. We can't lose our sense of meaningfulness in social connection just because we're not allowed to, or because it's too dangerous to. So during the first lockdown in the house that I live in, we participated every Friday in great big parties that were separated over some 250 households, where we all connected together through Zoom, and we had one facilitator called Charmaine Yap from the Sydney Dance Company, and she led us on these fantastic dances. We all played music, and she gave us steps, and we're all dancing in sync with each other to this music. And it was such a fun way of celebrating Fridays. I can't remember what they officially called these Friday dances, but we called them disc dancing.
But that's
and so, and what we would really go to town, we changed all the lights to put in disco lights, and we all dressed up, and it became so much fun, and it's something to look forward to every week. And so we can do that. You can do that.
This is something that might happen in Australia. Australia is very diverse. I have family there, Lebanese family, but Australia is diverse, so you have a lot of different cultures coexisting.
I'm sure it's everywhere. You just have to find it. You have
people might have it a little bit harder for this. That's what I experience here. I'm not French, so I find it a bit difficult. But I'm so grateful with your advice, and so grateful with the topics that you gift us, to understand the psychosomatic health and how is it linked, Can you tell me something about the psychosomatic health before we go? How we start getting sick from the environment, and how by thinking about it and it has an impact in our body.
So the way that I look at psychosomatic health from the salutogenic perspective, and I do use a salutogenic model for this because it's very useful, is as follows. That actually life is an uphill battle.
Is it a what?
It's an uphill battle.
Okay.
It requires physical effort to get out of bed in the morning. It requires physical effort to do things. It's tough. We've got lots of adversity, you know, little things. Every day bills are coming in. Every day you need to deal with some disaster, some minor disaster, crying kids, you know, small illnesses, big ones, demands of all these different sorts. We've got this barrage of difficulty which assaults us the whole time. And it's really, really easy just to give up, you know, and just go, why should I even bother getting out of bed? Why should I even bother engaging with all of that? And so the most important thing is to address that. Why should I even bother? Because if you find it hard to know why you should bother, then you're going to find it really, really hard to get out of bed in the morning. But as long as you feel meaningfully engaged, that sense of meaningfulness, as long as you feel meaningfully engaged, you'll leap out of bed in the morning. It doesn't matter if you're, you know, got bills to pay and stuff like that. You'll go and deal with it because you've got a real reason to. If you're asked, what is your reason for doing whatever you do, and you have a very clear answer for other people, then you've got a clear answer for yourself. It's because it's so important, right? If your answer is, it's because it's so important, then you've got meaningfulness in spades in your life. And that will keep you going. That is the power that you have to resist the entropic effect of life's adversity. Once you have that, then the next important thing is comprehensibility. You need to know what to do next. Sometimes that's a challenge, particularly people with psychosis, because they don't really necessarily have a really good measure on the world around them. You know, they don't necessarily see the world the same way as the people around them. But, you know, if you can find maps, if you can find theories, and if you can find understandings of the world that really make sense of the world around you, it will help. Because then you can use those maps, you can use those models in order to structure your life more meaningfully. I'm sorry if you can hear the music from the other room. No, you can't.
I'm sorry if you can hear my kids shouting in the room. No.
And so, and finally, manageability. You know, just being able to manage really helps. You know, if you, let's say you have a physical disability, you're a dwarf or you're blind, and you just, the world is not designed for you. It's such a pressure. Yeah. You know, you can't reach the switches, or you can't see where they are. Yeah, or whatever that disability is. If the world isn't designed for you, you've got a huge problem that you have to deal with. And that can get to you after a while. So psychosomatic health is where these three things, the obstacles in these three things just become so overwhelming, and you do not have the resources that you require to deal with them. You know, if you have the resources, all of this adversity in some way can be channeled to become the truth and become something that's meaningful. Adversity itself is meaningful if you can find meaning in it. You have a look at people who have been through war, and they talk about the meaningfulness of the connections they made and those relationships they had and their escapes and so forth, and they become stories that last generations. You know, meaningfulness can be found in incredible adversity. But at the same token, meaninglessness can be found in the same. So it's about how you process it. And so it's about your models and about what you're finding out of the environment. And if it all comes crushing down on you and you lose the ability to cope with it, you will find yourself ill. Whether it's temporary with some kind of cold, or whether it's permanent disability, both are possible.
That you are creating by researching and putting all this together, you are creating something really powerful.
Well, I hope that architects and designers and those people who are interested look up my work and the work of the people that I work with, and they find some inspiration. But as I said earlier, it's not that these ideas are, the ideas might be new, but they are often intuitive, and people find a lot of these ideas in very old buildings too, in very old methods of architecture as well, because they relate to our human condition. So having a strong theoretical approach does assist.
Thank you so much, Dr. Jan. There is any way, if the audience want to reach you, where
they can look at my website, which is psychologicaldesign.design rather, or they can email me jg@psychological.design. They should be able to get through to me that way. Thank you.
Thank you so much, Dr. Jan, and thank you, Marcel, my cousin in Australia, who
Thank you, Mars.
Thank you, Marcel. Anyways, thank you so much for this interview.
I'm actually teaching this stuff at a university in Turkey at the moment. In Ankara at Bilkent University, I'm an associate professor there, and I'm teaching a lot of material to the students.